The Disorders of Consciousness program is geared primarily to take care of the medical and rehabilitative needs of patients who are severely brain injured under the category of vegetative or minimally conscious, meaning they don't really have the capacity to fully interact with their environment. Most of these patients are victims of catastrophic events like car accidents, work-related and industrial injuries, and victims of violence. The rehabilitation involvement in patients eligible for the Disorders of Consciousness program starts even in their acute hospitalization when they are identified and medically optimized before they're transferred to inpatient rehab. When they're in inpatient rehabilitation, we do have the expertise to provide care for their medically complex conditions, which include spasticity, dysautonomia. From a multidisciplinary team approach, it is important that these patients are stimulated enough and medically optimized. That means that we do apply a lot of vestibular, positional, and auditory visual stimulation to try to stimulate recovery in these patients. Since these patients are relatively highly involved, family training and education is integral, as these patients' family members will tend to be the advocates as the patient goes through the continuum of care and transition into the community. We do this by a combination of frequent meetings and constant communication with the family members, which includes determination of plan of care, options, and transitions into the community. We do also do a lot of family training sessions to make sure that the families are able to address the patient's cognitive, physical, and functional needs as they go into the community. The UPMC Rehabilitation Institute provides a continuum of care that starts well before and beyond the rehabilitation stay itself. So we have the medical expertise to provide care for the patient's multiple complicated medical problems. We have the resources and the research background to develop paradigms of care in these very complicated patients. And we do concentrate on transitions of care from acute to the rehabilitation unit and back into the community.